I was excited. It's in terms of the presentation we had, and then having the ability to actually feel what the EMS machine actually done to your body was eye-opening, to be honest. It kind of gave you something that you can get, but it's quite hard to achieve a lot easier. So yeah, I was really, really excited. Strength mainly, and a bit of fitness. I'm like a lot of people out there, sort of kind of a little bit time poor. My priorities are my family in terms of my daughter, who's 7 and got absolutely tons of energy, who still thinks they're about 2 years old when they come running at you and jump on you, but they're obviously 4 times as heavy, and even the strongest bloke is never that strong when a 7-year-old throws themselves at you. So it was more sort of kind of just to give me a bit of sort of underlying strength that I've been lacking since going into more office-based role that I used to get when I used to work in retail. So it gave me that sort of once a week sort of kind of strengthening, which I didn't have, and it's fantastic, to be honest. I've been doing it for well over 15 weeks now, and I haven't missed a session because I don't want to. Firstly, it was like at the beginning, my diet's not fantastic, which isn't a great thing to say, but it isn't. So for me, it was sort of kind of, it was an underlying strength that I didn't really see physically at first. Now I am noticing that a lot more. I've always had weenie arms, in my personal belief. I had underlying muscles underneath all the fat. But now I've started to notice that like my upper arms are actually a little bit more defined, which, let's be honest, is quite nice. And even my front edge. I'm at a certain age where most men develop some extra padding in certain areas, but they're starting to flatten slightly, and my stomach is a bit more sort of flattening. I've still got a tummy, but I'm starting to notice the muscles, which is quite nice. Before, I'd be thinking about what I'd be doing. So like if I saw her running, I'm like, right, okay, if I fall, where am I going to fall? Or if she does come at me, how am I, like I've got to prepare myself. Now if she comes running at me, I'm just, it's second nature. It's back to being second nature when she's like 2 years old and they come running at you, just pick them up. Now it's sort of like she comes running at me, I'll just pick her up. Where before it was like, right, okay, bend my knees, straighten my back. I haven't got the strength for this. Am I too tired? But now it's sort of, yes, it's second nature. Especially afterwards, when you've had EMS, it is very much where it's the equivalent of doing 3 hours worth of strength training down the gym. You kind of have that, which I'll be completely honest, I'm not a gym goer, hate that sort of kind of stuff, but I can kind of understand why people go to the gym for 3 hours to get that endorphin release, to release that stress, but you still get that with 20 minutes of EMS, because it's a workout, but without it being a workout, if that makes sense. It's low impact. You're not lifting loads of weights or having to prep yourself. It's just a 20-minute intensive but low impact training, which gives you the results that you'd have to go probably 3 or 4 times down the gym in a week, which in the modern world just doesn't happen. I get most of my sessions with Jack, the master trainer, just because of how it works out. He's observed it as well as myself. It's sort of, when I first done it, there was certain basic moves, but I was a bit sort of kind of unsteady, and now I kind of just go straight into it, and he's sort of evolving that as well in terms of being able to change the exercises slightly, just to give me a little bit more of a challenge. I've got to that level now where the basic is good, but now he's keeps pushing, which is always good. Yeah, and to be honest, people are noticing around the clinic. Often I'm used as a body to sort of kind of train other people and stuff like that, and even the owner and Jack as well has noticed that like my squat technique's got better. I'm able to lunge a lot easier, and he's adapting the lunges to make them more challenging than just doing them standing in one position. It's sort of kind of active movement when I'm doing them, and I can actually squat properly now, which when I first started I could not do. I think the reason I'm doing EMS is I just want an underlying strength, which I'm getting already, but then it's also giving me the ability to keep going forward, because the differences are so vast and they come quite quickly. Like I said, I've been doing it for 15 weeks, which if you go into the gym it might take you months and months and months to get to a point that you have an underlying strength, and to be able to do that with 20 minutes in a week is fantastic. And now it's sort of kind of like, oh, okay, where else can I go with it? Like with EMS, it's combating sarcopenia, which is fantastic, which is obviously what I am starting to suffer from, because I'm now at the age of over 35, believe it or not. But it also means that I can start looking at using it to lose weight. I can give me better sort of kind of mobility and stuff as I get older, and the body starts to naturally sort of kind of deteriorate in certain areas. This is going to keep it at a level that I want it, and maybe even push it to be something that, or to a place that I haven't had it before. I think that's the beauty of EMS, is that there's not just one individual that can use it. Like we've got people that are in their 70s using it, we've got me who's in their 30s, I've got people in their 50s, I've got someone in their 20s using it, and it's like there's a benefit to every single sort of kind of generation. And to see like some of the people that were like, they couldn't even hold their leg out to get a pedicure, now going easy, I do it all the time now, it's fantastic. To give them that sort of a little bit of their life back through 20 minutes a week.